I'd like to bring in my real good friend, Dr. Joe Congini, Sports Medicine Center at Akron Children's Hospital. Good morning, Dr. Joe. What do you have for us today?
Hey, New Year, and I have a couple of sports medicine topics today, a little potpourri of a couple different things, maybe three little things, nuggets I wanted to throw out there. One of them was something that people are talking about in the sports medicine world of musculoskeletal is with heel pain. We know with Cleveland Brown fans, Amari Cooper sat out with heel pain. We know heel pain is pretty common in the sports medicine center. We see it a fair bit. And so, like a lot of other areas in the body at the heel, there are two major opposing groups of muscles that attach to the heel bone, the calcaneus. And the from above is the Achilles and the calf muscle. We've talked a lot about that in 2023. Below is the arch band on the bottom of our foot, and it's called the plantar fascia. And we really don't start seeing plantar fascial injuries till maybe 16, 18, 20. But then we really, in the 20s and 30s, a lot of athletes struggle with plantar fasciitis, and then a lot of adults struggle with plantar fasciitis. And this notion came up yesterday with that plantar fascia. There's a offensive lineman for the Cowboys by the name of Tyler Smith. He ruptured the plantar fascia, and the word is, oh my gosh, he might play this week or certainly in the playoffs. And a lot of people were scratching their head. Hey, geez, what the heck? If you rupture your Achilles, you're out for a long time in surgery and everything else. But this is a notion that's been discussed in sports medicine for a long time, is could athletes actually be better off to some extent when they rupture that arch band on the bottom of their foot? A lot of people struggle for a long time, and what happens, Ray, is they develop so much scar tissue that they're always in pain. They're always they have decreased flexibility and stuff in the arch band. They try all kinds of things, orthotics and shots and massage and a lot of different things. Many people, it causes them to stop walking and running, which, of course, this time of year we don't want to be doing as we get up to our New Year's resolutions. But the thing about it is it's not a very big power generator in the foot. So between the two, the huge power generator of the foot is the Achilles and the calf muscle, really important for strength. But with the plantar fascia, when it ruptures, I think a lot of the strength that we use with the bottom of our foot, the arch band, is taken up by a lot of the other intrinsic muscles in the foot itself. And people actually do pretty well, and a lot of that pain goes away sometimes after a rupture. So it's a little bit of a head-scratcher, and a lot of people were asking me about it in relation to this Cowboys offensive lineman. We'll see how he does, but there's several studies that show athletes get back to near full. So the strength part of that arch band must not be an important part of sports, like on the other side of the heel, the Achilles and the calf muscle. The second thing I wanted to mention is there seems to be a lot of controversy that came up, and I didn't catch it right off the bat, but read a bit about it yesterday, is the discussion of the severity of Elijah Moore's concussion. I know he spent overnight in the hospital, and when they have kind of showed some of the replays of it, there's question of whether there's involuntary movements. And some people around, that look in from the outside saying, hey, is that the posturing kind of thing that Tua had last year? Or was he having actually a seizure disorder, which really adds to the severity of a concussion? And so that debate is raging right now. But most of the stuff I've read coming out of the Browns camp and Elijah Moore, they think that he's doing very well, recovering quickly, and all these other things. But that's worth keeping an eye on, whether there was some involuntary movement. I really hesitate to make decisions from, 100 yards away, people looking at it. The medical team was standing about 5 feet away from where he was during that period of time. So I would give them the benefit of the doubt in diagnosing and deciding, about the concussion for Elijah Moore. The third thing I wanted to just mention, Ray, is the quarterback of my youth for the Cleveland Browns passed away on January 1st. Frank Ryan. He was really an interesting guy. Of course, the last guy to lead the Browns to a championship in 1964. Many people still say he was the smartest guy ever to play in the NFL. He was a mathematician at Case Western Reserve, and then he became a professor, a PhD at Rice and at Case Western and at Yale. And they say that during that long period of time, he taught the Einstein's theory of relativity when most of his teammates didn't even know there was one. That was a famous Red Smith quote about Frank Ryan. Very, very heady, smart quarterback, died at the age of 87 yesterday. So a couple things in the bag of sports medicine potpourri today, and I wanted to cover a few of those things today.
Joe, if you don't mind, I want to go back because locally I've talked to some high school athletes and older adult athletes that are around my age who have had problems with the plantar fasciitis. And, you know, the thing is they say rest. And I guess my question to you from sports medicine, rest obviously works with that. But once you get it, are you open with that tendon down below to repeatedly get this condition, or does rest kind of calm everything down? How does this thing become inflamed and become a big problem? Is it just overuse?
Well, it is overuse, and that stand is kind of like a mini trampoline on the bottom of your foot, so it absorbs all the shock all day long, and that's why people think things like orthotics are beneficial. Rest, of course. I see a lot of people changing their routine and pattern of working out. They will go more to a bike for a period of time, or an upper body bike, or maybe even an elliptical a little bit more. They have to get off of their running and walking for a while. So rest, like anything else that's an overload injury, will help quiet these things down. But if there is a lot of that scar tissue in that tendon, that scar tissue is really built up. When they go back, they find that there are recurrences. And so there's a whole bunch of things the sports physical therapists do to try to get rid of the plantar fascia, but it is one of the most difficult conditions to get rid of when it passes from acute, which means in the first 6 weeks, to when it's chronic and it's been 6 months or more and people have been struggling for a long period of time. Sometimes with the injections, it may actually predispose to possibly rupturing. And again, that's where this debate comes up. Rupturing isn't the worst thing for an athlete because a lot of the pain will go away, and it doesn't seem to be a crucial muscle from the standpoint of strength on the bottom, muscle tendon on the bottom of the foot. And so it's just an interesting debate that's going on right now in the sports medicine literature. A lot of people talking about that. But it is really hard, Ray, to get rid of. I think you and I have talked about it even, from time to time.
Yeah.
Hey, I have to change my routine or rest a little bit because I'm struggling with that plantar fascia.
Great stuff this morning, Joe. As always, my friend, thanks for putting in the time to educating us in the world of sports medicine. Always appreciated. We'll do it again next week.
Happy New Year, Ray. Thanks.
Same to you. Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital, joining us live this morning.